Hello, Camilla. Welcome. So happy to have you here to talk about your birth story.
Thank you for having me.
And you have a 6-month-old and you're joining us from North Carolina. I got that right.
Yep.
And
My older daughter is 4.
okay, older daughter is 4. And where do we even begin? We spoke a little bit. You shared with me a bit about your story on DMs, and I was like, I need to interview you. And you were like, okay, let's do it. So
Um,
where are we gonna start?
so my oldest daughter, we were actually living in Tampa, Florida at the time. She is 4 now, so it was 2019, just before COVID. I was an ICU nurse at the time. And then when we were planning her birth, I wanted a birth center or like home birth. I had read Ina May Gaskin's book. I like even thought about going to the farm. Like I was very, but through my insurance, I could give birth at the hospital I worked at for $200. So it was like a financially motivated decision, um, which, yeah, I have a lot of regret about that now. But there was a midwife group there at the hospital, so I went to them, but there was about 20 midwives in the group. So it was a huge midwife group.
Okay.
And I tried to see as many of them as I could throughout my pregnancy, so I could like get to know them each. And there was one that I really didn't care for, and we hit 41 weeks, and my appointment was with her, and she was really like, "You need to be induced now, da da da." And I was like, "Well, my mom had long gestation, like I think part of it's just genetic, and I would really like to wait until like there's a reason." And I mean, she was like, "Well, that's like saying I had C-sections because my grandma had C-section." I'm like, that is not actually the same thing, but okay, sounds good. And so I went in for like my BPP, and everything was perfect. So I went another week, and I was really trying. Like, I mean, I did everything. Like I did the evening primrose oil, like vaginally, orally. I drank the pineapple juice. We had very uncomfortable sex, long walks on the beach. Like,
Oh God.
I actually put myself into like a little bit of labor that just wasn't true labor, because I like did like a mile walk on the beach in the sun, and then played Guitar Hero, and then went bowling. Like that
Wait,
would,
wait. So
be
you were
great.
how many weeks were you at this point now?
I was like 41 plus.
Okay.
So at 41 um and 6, I went in for induction. They would drop me from the midwife group if I didn't go in for an induction at that point. And I knew, working there as a nurse, that I gotta get my baby.
No worries. Get your baby. This is real life, folks. So you go get your baby, and while you go do that, I'm going to recap what you told us. Okay, so
Okay.
go on. I'll just do a little narration. So, okay. Camilla is an ICU nurse, and she had a negative birth experience with her first baby, in that it was, I mean, we're going to hear the whole story, but the induction, a lot of interventions, feeling like her voice wasn't heard, and having a hard time advocating for herself, and just not really feeling like she was in the best hands. So I was just sort of recapping that you kind of felt like you weren't really listened to or heard in your first pregnancy with respect to the care that you received. Am I correct in saying that?
Correct. Very correct.
Okay.
Yeah. So we went in 11 a.m. on a Monday morning for the induction. And I mean, they'd been calling me like every day, and I had put it off to like the last possible moment.
Mm-hmm.
So I went in, and they did Cervidil, and then about 2 p.m. did a Foley bulb. That fell out about 5. I had dinner, and they started Pitocin. And I am not sure like what rate they did it at, but they had me maxed on Pitocin by like midnight. And just, it was rough. I was I didn't want an epidural, so I was using the gas. I was
Oh,
trying to move, but I didn't have a birth pool, couldn't do the shower because of the continuous monitoring. My husband was like trying to get some sleep. I had him reading me some like hypnobirthing stuff that kind of helped, but then like he was super tired. So we get to like 9 a.m. the next day and they do a cervical check and I'm at a 5.
oh
And
God.
so they were like, I think we really need to break your water. And I was like, and not yet. So waited another hour. And then they came back in and they were like, it's just not progressing. Like if we don't break your water, we're gonna have to do other things. Like, they were kind of like
Mm.
veiling the threat there, but it was like, okay. So they broke my water and I immediately just had this like intense, terrible back pain. So
Mm.
I think she just switched OP when they broke, like she wasn't quite engaged far enough yet. Um, so then I was in a whole nother realm of pain and I was like, had a um the nurse come in and talk to me and she's like, well, I really think you should just do the epidural. Like it helps people relax with the Pitocin. And I was like, I'm fearful that I'm going to be stuck on my back, which you talk about a lot. And I just did not want that scenario to happen. And
Yeah.
she had midwife contact me and they were like, no, we'll get you moving. You can do all sorts of things and we'll let you move around with it. It'll be great, whatever. So I'm like, okay, as long as I can move. So they did the epidural. I was able to like take like a sideline nap. I woke up. The nurse was great. She got me on like my hands and knees. We did like some shake the apples. Things were like really starting to move along. And I got to like 9 p.m. at that point. So we'd been there, I mean,
Long time.
days.
Yeah.
And the nurse did a cervical check and I was at a like 9.5, she said, like with a cervical lip. So I was like, oh great, okay. Um, and then shift change, new midwife comes on. It's the one that I had been fighting with the whole time. This was my third shift of people. So
Yeah.
my third different midwife. And it was just
Not what you were hoping for.
not what I was hoping for. And okay, so the new midwife that I had disagreed with the whole pregnancy comes on and she's like, get on your back, lay down. And I'm like, that is like a very uncomfortable position for me right now. She's like, well, I need you on your back so I can properly check you. I'm like,
Mm.
okay. So I get on my back. She checks me and she's like, no, you're not even an 8. You're not even anything.
How do you reverse in dilation?
Well, and I had read, I don't know in what book, that if you're like uncomfortable with a caregiver,
Mm.
that you can reverse dilation because of your discomfort, that your body just like, you know, does that. And so
So let's start.
she does
Let's do,
that. And then
well,
she won't let me. I was very comfortable on my hands and knees. My body felt, really
yeah.
good. The baby felt good. Like she had been perfect vitals this entire time. They've been doing continuous monitoring. Um, and she's like, no, we can't do that. You need to stay on your back. And so like I was at that point then just like panicked, like she's not letting me do anything that I had planned on or wanted to do. And then I started feeling like very pushy. And I told so the nurse had come in on shift change too. Like, I don't know why the hospital did this to me as a nurse who worked there. They gave me brand new first day off of orientation. Literally first day of orientation. At like the very end, I was like 30 hours into labor at this point. I'm like, oh,
So you're,
why
and
did you
this is
do
the
this?
hospital you work at as an
Yeah.
ICU. And how long have you been working at this place? Like, how long have you been a
I was
nurse
there
at
for
this
5 years. Yeah. So it was like, yeah, that was tough. And so then I told her, so she went and got the charge nurse. The charge nurse came in and she's like, okay, I'll go get the midwife. She comes in and she's like, gets down there again, gets all up in me, and she's like, give me a push. I'm like, okay, I don't know how to, just give
Yeah.
you a push. And she's like, just pretend like you're trying to poop. And then she's like, oh no, this is never gonna happen. You need to go for a C-section now. I'm like, what? And she's like, yeah, this isn't gonna happen. It's been too long. I'm like, okay, well, I need you to just give me another hour. And I was like crying at this point.
Oh
And
my
she's like,
God.
there's nothing wrong with the C-section. I've had 3. It's fine. was like, I mean, I'm bawling, my husband's bawling. I mean, it was just like, and then we have this brand new nurse that's like, oh, I don't know what to do. And so we're waiting the hour. I spike a temp. And so then she's like, comes around there, you have a choreo infection. This baby's going to be septic, need NICU. Like, what are you doing? Like, very,
Oh,
very guilt ridden, sign this consent. And then they anesthesia came in to check my epidural, and the entire right side of it wasn't effective. And so they just start pushing these meds as I'm laying flat, which it's so ironic that they're like, never lay flat in pregnancy. That cuts off blood flow to the baby. And they're like, here, lay down completely flat with this baby that's trying to move down and out of you. And so the baby has a huge D cell. They rushed me up to the OR, rushed like super emergent. My husband almost missed it completely. Like, and then they said, so they called like stat for the attending surgeon overhead. She comes rushing in. They cut me and my uterus tore because she said it was so tired from all the Pitocin, from being maximum Pitocin for so long, that the tissue was weak and it tore that early. And she, as I'm literally throwing up and crying on the OR table, she says, you should never have a vaginal birth. And then she leaves and lets the resident finish the surgery.
I'm sorry. Like, what? What?
I mean, it was, I mean,
If
just,
they are
yeah.
treating you and you're like one of their team members, you're a
Mhm.
hospital employee, you're a nurse yourself, and they're treating you with such disregard and without any empathy
Mhm.
whatsoever.
Yeah.
And oh my gosh.
I mean, the anesthesia team was very sweet. Like the CRNA that was with me, I like by my head, he was very kind. And some of the nursing team was great, even though she was so inexperienced. And just even when she hung some antibiotics for me when I spiked that temp, I had to like teach her how to piggyback the antibiotics as I'm like in labor. I'm like, what is going on here? Like, this is just so
Outrageous.
bizarre. And then I had, since I was going in for an induction, I had done all this research. I was like, okay, 25% of inductions end up in C-sections. So I'm going to write a C-section birth plan. So I had one like completely written. They disregarded like all of it. And like, even I had put on there like no eye ointment. Like they bring her over to me completely cleaned, wrapped up, eye ointment on.
Mm.
Like, and then I had written like that I wanted her to stay with me as long as possible if she was like warm and fine and whatever.
Mm.
Whisk her away, take my husband with her. So I'm like all alone. And this is like in nursing school, I had watched a C-section and the mom and the baby and the dad left, and mom was all alone, like crying on the table. And I was like, that seems so traumatic. I never want that to be me. And then it was me. And I was like, oh, this is just, you know, everything I never wanted. So it was,
I'm sorry. That's a lot. This was in
yeah.
Tampa?
Hmm.
Okay.
Yeah.
And then how long did it take you to want to even have a second baby?
I mean, we started trying when she was like 3, but I mean,
Yeah.
I wasn't super excited about it. Like
Sure.
it was more like my husband wanted another one. I was like, okay. I mean, I want another one. I don't know if I want to go through that, but okay, let's do it. But
Yeah.
I just, you know, mentally was tough. And then I was like, I want this, to be
Different.
completely different this time,
Yeah.
right? So after the last one, like at my 6th week, I had tried to get in with that same surgeon so I could ask her like, why should I never have a vaginal birth? Like, what was
Mm.
going on that you said that? And they're like, oh, she doesn't take clinic hours. You can't get an appointment with her. I'm like, oh, okay. So I had an appointment with a different OBGYN, and he was very, very nice. And he like read the op note and he just said, oh, I see no reason you can't have a VBAC. He was like, your uterine rupture chances might be like slightly higher just because of that tear. But he's like, it doesn't extend into any like contractile tissue. Like, it's just going to be a bigger scar internally, but it should be fine. And so that was like at least reassuring, but it was
Yeah.
still just like mind-boggling that somebody had said that to me, walked away, and
Oh
like
yeah.
washed their hands.
Oh yeah. Well, it's interesting that the midwife that you had that was sort of like dismissive and you didn't connect with, she herself had had 3 C-sections. You
Mm-hmm.
wonder how much maybe she was projecting unresolved trauma of her own onto
Yeah.
you, other patients, right? Like, anyways, that's a whole other like interview slash discussion, but
Mhm.
there's a lot there for sure. So I would wonder when you decided, okay, we're gonna have a second baby, you got pregnant, and it had been a few years at this point. I'm assuming like maybe 3.5 years or so, I'm guessing by the math, rough math.
So, I actually breastfed her till she was 3. And
Amazing.
so we had been trying for a while, but we didn't get pregnant until the month after I
Uh-huh.
stopped breastfeeding. Even, I mean, I was only night feeding at that point, but
Yeah. Yeah. Bodies
whatever.
are wild, huh?
So, we tried for about a year actually before we
Okay.
got pregnant.
It's a journey in and of
Yeah.
itself.
But well, that was like, that's the funny thing though, is I was fine with it. I was like, well,
Yeah, well, yeah. And then you were pregnant, so then you're pregnant again. And then what's the first thing that goes through your mind? And I'm sure anyone watching or listening to this or watching this who has had a previously traumatic birth and then conceives again, like what are the thoughts that immediately, like normally it's elation and joy, we're gonna have a sibling. Like, was that what happened for you? Or was it more like, oh my God, like anxiety or dread? Or was it a combo of both?
it's a combination, but I had definitely been like prepping for it for a long time. Like I had, after her, I had joined the VBAC link community like on Facebook, like
Mhm.
probably as soon as my trauma was a little less like,
Mhm.
you know, she was probably like 9 months old when I joined that group. And so I was reading other people's stories a lot. And then as soon as we moved to Charlotte, I had asked in like a mom's group, who is the most like VBAC friendly in the area? Because I just was like trying to make sure I got a great provider. So
Yeah.
that's obviously, a big proponent. That's what I felt like really got me at the end. So I heard there was this great birth center called Natural Beginnings in the area that did VBACs. They weren't allowed to do them at the birth center, but the group would follow you and the group would deliver you at the hospital. So I was
Okay.
like, oh, that sounds promising. And that was, she was probably 2.5 at that point. Well, by the time I got pregnant, the hospital rescinded VBAC privileges for that birth center. So they're not allowed to do VBACs anymore.
Okay.
So then I found this OB that people had highly recommended for VBACs. Went and had an appointment. And I mean, she seemed great. But what was funny about her group was that 2 nurse practitioners are who see you throughout your pregnancy. And I'm like, that's so bizarre because they're not going to see you at the hospital. You're like
Mhm.
building this relationship with someone who's not going to help with your birth, So it
Yeah.
just seemed like a strange, thing. Um, but anyway, so I told the one nurse practitioner like my entire story, and I was like, I want to be back. I do not want another C-section. And they seemed very great. Went to my like next appointment, and she was like, okay, so if you're not in labor by 41 weeks, we'll schedule your C-section. And I was like, excuse me, no, you will not. We're not scheduling a C-section for just because you hit 41 weeks. So I was like, oh, I need to do something different. So I started researching home birth, and North Carolina is a tough state because CPMs are not licensed, and that's who usually performs home births.
What's a
It's
CPM in the
certified
US?
practical midwives versus certified nurse midwives.
Okay, got it.
So certified nurse midwives are allowed to do home births, but most of them work at hospitals or birth
Okay.
centers. Like there is none in the Charlotte area to do home births. And so to clean this thing.
So like no, very few people actually get home births in North Carolina by
Well,
the
so
sound of
there's
it.
an underground
Oh, exposing them right now. This is
there's an
bad.
underground network you can go on to find a CPM that will do a home birth. And so I joined this group and I talked to some home birth midwives. And there's one she's like the mother of all home birth midwives. Like she's been doing it for like 50 years and like everybody like trained with her and knows her. I buy new fish for us. Oh, great, honey. And so I talked to her and she had just had cancer and gone through chemo and was in remission. She was like, I'm cutting back on my births. I needed to take some time. I was like, understandable.
Yeah.
She was like, I would recommend this midwife for you. And so
Okay.
I went to her and talked to her, and she had 7 kids, 2 C-sections, and then 5 VBACs at home. And I
Wow.
was like, you were the one for me. It was great. She just like she understood, and I mean it was such a wonderful experience. Like just compared to my care with the first, like having
Mhm.
20 different midwives, I'm trying to see to this one where I'm like seeing the same person every week and having an hour-long appointment where I like lay on her couch and tell her my life, and like she was like I was,
Yeah.
whatever drama issues, anxieties, she would be like, if like my husband travels a lot, she'd be like, if he started telling you, call me, I'll come have tea with you, whatever. Like I mean, it was just really wonderful. She was great. Um, and she was like, if you go over, like, we can do a BPP. I have ultrasound tech. We'll go do that. We can do some different tests, make sure everything's good with the baby. And then, I'm perfectly fine. We just need to monitor more. And so I was like, immediately felt this like weight lifted. Like,
Yeah.
I don't have to worry about induction. I don't have to worry about being handed off. Like,
Right.
you're going to be there and like my body can go when it's ready. And it was just like such a weight off my shoulders. It felt so good.
Did you have any pushback from family members who were sort of like didn't understand your decision making?
I didn't tell anybody.
That's one way to handle it.
Yeah,
Okay.
no, I told no one. I told like a couple close friends and my husband, obviously, and
Yeah.
that was it. I didn't tell anyone. Um, and my OB group I'd been seeing, I had my anatomy scan, everything was great, and so that was like reassuring to have. And then they canceled my next appointment. Like the person it was with had changed their schedule and was gonna be out of town or something, and they canceled my appointment and they never rescheduled and never called again. And so I
And
was like,
that was that.
perfect out. Okay, so yeah, just never heard from them again.
Wow. So,
No, I'm
okay,
like,
how does it work for anyone? I'm curious because as a Canadian, like midwives are covered, OBs are covered, home births are covered, like it's all covered. We don't pay anything. How does it
yeah,
work
so
for you? Like,
out of
did you just have to pay out of pocket for every visit?
yes.
Okay. All right.
Mhm.
Got it. All right.
But I was also like, after last time having made my decision based on finances, I was like, this time, like,
Right.
I will go into credit card debt. Like, I don't care. Just
Mm,
like, I
yeah.
need to have a better experience. So I was like committed. But I mean, actually, it was $5,000, and
Okay.
I feel like that's not that bad for a lot of people after insurance. They're probably paying that much,
Yeah. Yeah. That's a whole other conversation that I'm not familiar. So I just to hear the
Yeah.
stories of like what things cost is always a bit like mind-boggling. But
Hmm.
yeah, especially given your previous experience and like how you were feeling, like there's, if $5,000 gives you peace of mind, then that's not a lot of money for, it is for a lot of people, but again, like your mental health, your emotional state, like that's worth something.
Hmm.
Yeah.
Yeah. And I mean, I'm not sure how much our insurance would have covered, but they also charge you different if you have a vaginal birth or cesarean, or I've seen people getting charged more for VBACs,
Oh,
like
really?
extra risk. I don't know. So yeah, on the
Oh
VBAC
my,
link, like people will post about that stuff, and it is just, I mean, it's different every state, it's different every insurance, but it
sure.
is mind-boggling.
Yeah.
So
Okay, so
yeah,
let's go into the actual birth of Quinn. No, not Quinn. Sorry, little one.
Millie, yeah,
Lily.
Millie,
Millie. Your
yeah.
second.
So Quinn's birthday is October 30th. Millie's due date was October 28th.
Oh my God.
So, but I was like,
Scorpio
it's gonna be fine.
babies.
I'm gonna go late. I go late. It'll be fine. And then my parents, which that's a whole nother thing, but my mom was like, we're coming to visit over Quinn's birthday. And I'm like, that is right over my due date. Okay. Um, Probably not gonna go into labor till after they're gone because I
Yeah.
find that very stressful. And so I was like, okay, well, we'll just be ready for the next week. We'll have Quinn's birthday and we'll celebrate and it'll be great. So the day before, I had a prenatal massage um, already lined up because I was like, well, if my parents are gonna be here, I'm gonna get some
Mm-hmm.
time,
Yeah.
to do some things for me. So I did that. It was like an hour and a half long, and then me and my husband were able to go out for dinner that night. And then the next morning, um, about so I had been getting up more to pee that night, And I thought it was just pain because my bladder was full, but I think I was actually probably having some like mild contractions. And I got up about 7 and I went to the bathroom and I was like, my underwear was super wet. So, gross.
Mucus
But I
plug
took them off. And so I went
or
downstairs to
amniotic
like,
fluid? Were you leaking already?
well, so I went downstairs to make a bagel, had this huge bloody show all over the floor, like everywhere. I'm like, oh no. So I'm down there like scrubbing that up, go upstairs and had like more. And I was told my husband, I'm on the floor. I'm having like a huge contraction. I'm like, oh, I'm in labor. And he just laid there. He was like, no, you're not. Like,
How many
baby
weeks are
isn't
you now
coming
at
yet.
this point? Like how
It
many
was like
weeks?
exactly due date. So I was 40 weeks.
Okay.
But I mean, I think we were both just kind of like shocked because we were like, there's no way. We're like, there's no way we're like gonna go early or on my due date. Or even the midwife was like, oh, this baby feels pretty small. Like you'll probably go long again. And so just came out of kind of blue. But I texted my midwife and she's like, oh, that's great. Okay. Just keep me posted on how it's going and when you want me to there and whatever. And so we had already planned on going to this like farm for a corn maze and all sorts of like fall fun stuff, right? With
Fun fall family activities.
So I was like, well, let's just go. I'm like in early labor. The walking will be good. It's like, curb walking, but through a corn maze. It's great, right?
Oh my God. And you get lost? No, where are we going with this? Like where's the story going, Camilla?
So I was like, well, you can stay there with my parents. We'll go. And so we went there. My parents still didn't know I was having a home birth. And so my husband's like, you need to tell them. I'm like, well, yeah, I know. I just don't have like my mom's not asking me any questions. Like, why isn't she asking me some questions so I can And so finally we just had to be like, okay, listen, we're having a home birth. We don't want you at the house tonight. My husband was like, I got you an Airbnb. Here's the info. And then we really want Quinn home. Like I wanted her home for it. And my mom was just like, oh, you're gonna traumatize her. I'm like, no, she'll be fine. Just leave your phone on, please, and like respond to our messages. And she was like, oh, I think it's on airplane mode. I'm like, no, please turn it on. And so we leave, we grabbed some lunch, went home. I wanted to watch dodgeball because I wanted to watch something like funny to get the endorphins going. So I was like on the watching dodgeball. And then I was like, I think I need a rest. So me and my husband like laid down, like cuddled, napped for an hour, and then I was feeling so anxious because he texted my mom twice and she didn't answer. And so I'm like, where's Quinn? I need her home. I need that was part of my thing. So I wanted her home. And so they just I should pick. And so they finally get home. It's like 6 p.m. And the minute they get home with her, like my contractions just went from like 8 minutes apart to 5 minutes apart. And I was like, call the doula. And my husband's like, well, are you timing them? I'm like, just call her. I think like she needs to come. And then we took turns like every night seeing my daughter and like snuggling her. And she's like, oh, it's your turn to snuggle mommy. And I was like, what is my last time of just her? So I wanted to snuggle her. So I was literally like horse lip breathing, 3-minute apart contractions, singing like Silent Night. She's like bopping me on the head every time I stop to like breathe. Mommy, keep going.
You're like, hold on, silent.
Yes.
Oh my God.
So I come crawling out of there at like 7:45 and just like burst into tears. I'm like, Kira, where are you? And he's like downstairs making me food and water. Like he's trying to take care of me. I was like, where's the doula? Like, what's going on?
Yeah.
Picked up so fast. And so he comes up, he's like trying to feed me bites of rice between contractions and like reading my birth cards to me. And then my doula gets there. They tried to get me situated in bed, like side lying to like relax. And I was like, that's not happening. Like, this is way too intense. And so we tried to get in the shower. I lasted like, I don't know, maybe 10 minutes. My legs were just so tired.
Yeah.
And so I sat on the birth ball. My doula did like counter pressure. My husband was reading my birth cards. And then I think I was starting to hit like transition. I was like feeling very pukey, sweaty, like shaking. And I like looked up at them and I said, where's I said her name, but I was like, where's my midwife? Is she, is she here? Where's she coming? And they looked at each other with like,
they didn't call her yet?
Doula goes, I better go. I'm gonna go call her.
Oh my God.
And so I think they just didn't realize like where we were because I was, in my own
Yeah. You're in
thing,
labor land. Yeah. And you're like,
and they, they're in their own doing their thing. And I'm like, the birth pool. Like that was my husband's only job we had planned for was like Dula was gonna take care of me. He was gonna get the birth pool ready. And so he goes to start getting the birth pool filled. He forgets to put the liner in, which
no. Oh my
like
God.
so I had no idea what was going on still. And then I'm like, oh, I feel something bulging. I was like, it's my waters. I'm pretty sure. So I like told my doula, I'm like, my water's gonna break. Grab like the flannel back tablecloth and put it on the floor. And I got down the floor. My water immediately just like broke
You're
everywhere.
still being a nurse, like to yourself. I just want to call that out. Yeah. Okay.
Can't shut it off.
No.
So then after my water broke, I was like full on fetal. I could feel my body pushing. I was like, she's gonna come out. Like, and I'm not in the birth pool, which I was my plan. Like, because my midwife was like, nobody really tears in the pool. Like, if you give birth
Right.
in the pool, you don't really tear. So I was like, I'm gonna birth in the pool. I kind of want to tear. That sounds
Yeah.
great. And so I'm like asking my husband, like, is the pool ready? I want to get in. And he's like, you're doing great. I'm like, that's not what I said. I'm like, what's going on?
Answer my question.
You're doing it. And then my midwife walks in. And I was just like, oh, she's here. And I see her like conferring with Garrett. I don't really know what's going on. She comes over and she goes, so Garrett forgot to put the liner in. You can obviously still get in the pool. You'll just have to pay for it, but I don't think you really care at this point. And I'm like, no. And she's like, or you can go labor on the toilet for 2 contractions. We'll fill up your bathtub and then we can get you in there. I'm like, that's fine, whatever. I don't care. Just like, and so Garrett basically like carries me to the toilet. I have 2 contractions there. They're like, the bath is ready. Do you want to get? I'm like, get me in there now. I got in the bathtub at 10:25. She came out at 10:36. 11 minutes.
Oh my God.
And I was like, nuchal hand. She was just, she was ready. I'd been ready for a while. Oh yeah, and I told so when I was having fetal ejection reflex and was waiting for the pool and the midwife, I was literally just like,
Whoa. Yeah, you gotta
ready.
stop. You gotta stop.
Ready.
You gotta slow it down. The freight train's coming. You're like, slow down, slow down.
Uh-huh. Yeah, my favorite birth card that I read through the whole thing was like, inhale power, exhale the baby down, and I like did your breathing like while I did it, and it was just so great. So she came out. My placenta came maybe 10 minutes later, like no problems. And I mean, it was like magic getting her, like pick her up, hold her to me, like sit back and just like look at her, and she like nursed right away, and just like it was so beautiful. And we just got to like, the midwife like came and monitored her like while she was on me in the bathtub, and then they were like, okay, the water's getting cool, so they had like some hot towels in the dryer for us, like wrapped us all up on the bed, like took her to weigh her, did my exam, and then we got to just like snuggle up. They brought me food and drinks and cleaned our house, cleaned the bathtub, and it was just like, it was amazing. It was so lovely.
Oh my God. What
So
an amazing story after what you went through with your first. Like just letting that
yeah.
sink in. Like just so like the opposite in many ways. Still like some shit that happened that you're like, where's the pool? Like, like sorry, but like we just rented this thing, like late arrival of the midwife, like still things that you're kind of like, but I mean, you got that skin to skin. You got to feel, your baby. You got to feel like you had a say, a voice, that you got to feel that. I'm just so happy for you.
And I didn't realize how violated I felt by all the cervical checks until I had none.
Mm-hmm.
Like, because every cervical check they would have, they'd be like, oh, you're only at this,
Mm-hmm.
or it's only this, or like, and it was just so negative all the time. Or even when you're 9.5 and a lip, it was like, okay, I'm excited. But then the midwife was like, no, you're not even at 8, nothing. Like, you're not having this baby. Like, so it was just, and then for the next one to just not have any of that, it was just me and my body. And it was like, I don't need somebody checking it.
Mm-hmm.
It's doing what it's doing.
Yeah. No opportunity to make you feel like your body is somehow deficient or not doing what it's
Right.
supposed to. Yeah. Mm-hmm.
Yeah.
Oh man. And how was I have questions about Quinn and how her reaction was and where she was in all of the
So she
your
was just in bed sleeping the whole time.
okay.
So yeah, we put her to bed about 7, and then um she got up at the next morning and came. We are like, the baby's here. She came in. Like she was like very didn't
Yeah.
know.
Yeah,
Like I don't really want to touch her or hold her or see her. And then I had like I don't know, the baby bought her a present,
of course. Yeah, that's the way to
and
do
so I
it.
was like, your sister got you something, and so she opened it, and then she was like, oh, I want to show her everything. So she had my husband like carry her all around so she could show her all her
Oh,
toys in her room and
oh,
everything. It was very
amazing.
sweet. So I just had to get through the first
Yeah.
little
And
hurdle there.
yeah, fair, fair. It was good advice. I remember after having a second, they're like, make sure baby brings the older sibling as a present. I was like, good plan.
Hmm.
And
Hmm.
how was your mom and your parents after all that?
Well, so then my midwife was like, you're gonna stay in bed for a week. Like you can get up to go to the bathroom,
Hmm.
don't go down your stairs, don't do it. Like just rest. You and the baby will stay in the bed. Your husband will take care of Quinn, and that's the plan. And so, and Garrett was very committed to it. My husband, he was like, yes, we're doing this. And so my mom would be like, why can't you just come downstairs? Just come down here, bring the baby down. And Garrett would be like, don't you dare. Midwife said no, you stay
Yeah,
upstairs. So I mean, there was a little bit of that, but I mean, mostly it was nice because then it was Quinn's birthday
right.
2 days later. And so my mom was there to help, and we like upstairs, since my room's upstairs, we set up like a whole party up there with balloons, and she came had cake and presents, and
Oh,
it was
wow.
it was nice to have her help with that stuff.
So
And
how many days
so
apart are
and we
they?
ended up two two
Only
days
two
apart.
days apart. Oh my gosh.
Hmm.
October's busy in your family, I'm sure.
Yeah.
Oh
Hmm.
God. Okay, so I asked this question to everybody. What advice would you give yourself to your pregnant self now? Let's go back to you being now knowing what you know and having experienced what you've experienced. If you could go back to your first time pregnant self, when you were first pregnant with your first baby, what advice would you give yourself?
I think just I let things be barriers that didn't need to be. Like I let like stupid financial things that wouldn't have, been our detriment, but it was just like, I don't need to spend money on this. But it was like, I should have just spent the money. Like a doula. I was like, I don't want to spend the money on a doula. But it's like, even if the outcome had been the same, it probably would have been less traumatic if I had someone to like rely on a little bit, and to like be there to advocate for me. So I'm like,
Mm-hmm.
and that money, it's just money, you know,
Okay.
like it's all going away someday anyway. Just spend it like, and do the things that you need, like, or like chiropractic care. I did
Right.
that this pregnancy. Like I went every week, every 2 weeks once I hit 37.
Hmm.
And like I thought, I mean, that because with Quinn I had really bad like sciatic pain, and um this one I did, and I started going, and it was
Hmm.
great. Like it just, yeah. So I was like, why did I not do that? Because I didn't want to spend the money on a chiropractor.
Right.
Like, like it's just silly things that it was like after the fact, I was like, that was so silly. Like I should have just done
And
those
yet we
things. I
like
knew,
buy the best stroller or we buy the
right.
best, stuff. Yeah.
Yeah.
Yeah, I hear you.
Like, I knew the things that could help me, and I still
Yeah.
just chose not to do them. And I should
Hmm.
have just gotten the doula, done the chiropractic care, and, like,
Prioritized you maybe is the
yeah.
theme. Yeah.
Hmm.
Okay. And what advice do you have for anybody listening to this who is hoping to have a VBAC?
Well, my number one advice I got from my midwife was to never recline, like to sit forward or upright. So I never reclined my entire pregnancy. I never like laid back in a chair or a couch just for that baby like positioning. And I think that probably did wonderful things. And then your course made me feel so confident, like, and just like how to work with your body, and like how to breathe and how to activate your core, especially after a C-section. Like you don't know what, like I had pelvic floor physical therapy. She was 6 months postpartum because I was having painful sex, and they diagnosed like very tight pelvic floor. And then it was like, oh, is this why? Is this why I couldn't have her vaginally? Which I'm
Mm.
sure not, but like that's the kind of stuff that goes through your head. And then you don't understand that. Like she was like, no, it's tight because the C-section like severed those ties from you to your like TVA.
Yeah.
And then your other muscles are trying to do all the work. And so they're at this constant state of like tension. And
Mhm.
so it's very tight because it's compensating for things that you no longer know how to work. And I'm like, oh, yeah,
And it's
that
gotten
makes
better, I
sense.
hope. I hope.
Oh, it's
Okay.
and honestly, Mike, I'm doing your. This is not supposed to be an ad for you, but like I'm doing your course too, and I feel like my core is stronger now than it was 2 years postpartum, Quinn. Like just like having some like I do a different like workout program, and I remember messaging them like, okay, in postpartum, like how am I supposed to breathe during a squat? Like
Mm.
how should I be breathing? And when should I be inhaling and exhaling? And like just no one ever answered me, and I was like, well, I just don't know. Like and like it's been a game changer. Like it's I have recommended it to everyone. Like
Aw, thank
my
you.
sister-in-laws who are like way postpartum. I'm like, you need to do this. Like
It's never too
it'll change
late.
your life.
It's never
It's
too late.
great. Yeah. So
No, it's never too
I mean
late.
that was
You kind of have to be sometimes a little bit of a rebel, don't you? Like
mm-hmm,
with respect to like, especially when I'm just putting myself in your situation where you were sort of like, you had a lot of stuff stacked against you for getting your VBAC. And you had to make
mm-hmm.
hard decision after hard decision and truly like fight for what it is that you wanted. And that, like, I think, I don't know if you've paused to recognize that, but like, that's pretty badass.
Thank you.
Seriously, it is. You're like, yeah, you're like, oh, you're momming and you get caught up in that. But like, no, like you are a force. Like that's pretty fierce to be able to be told, no, you just need, we're just going to induce you. And then you're like, no, I'm going to go underground, like, which is so crazy to me that you have to do that where you live. But anyhow,
It
so then,
is so
and then
bizarre.
you're like to get your home birth. And so then you have to find a different midwife. And then I'm just recapping everything here. And then you find the other midwife, and then you're dealing with like a lot of different opinions, and like, you're sort of guarding your emotional state and space as well, because you know that not everyone's going to understand your decision making.
Mm-hmm.
And, and just like, yeah, working through that and then choosing to trust your body, even when you had a doctor say you can never have a vaginal birth. Like that's a lot of you taking information and then saying, no. It's still doing what you were, that is
Yeah.
not easy, friend. That is not easy. So do you think being a trained medical professional yourself as an ICU nurse helped you in any of that? Like
Oh,
trusting?
absolutely.
Okay.
Yeah. Just
'Cause
like
this is not common. Like I'm just calling that out. Like I think a lot of women in your situation would be like, I guess I can't.
well, just being able to understand like medical jargon in the first place. And then after she was born, I did all this research and I was like, oh, choreo infection is not an indication for C-section. Like
Mm.
outcomes are just as good if you have a vaginal birth with a choreo infection as a C-section birth. So I was like, that whole like sepsis NICU scare tactic was like had no base behind it, like nothing.
Mhm.
And then like I read like the surgical report and it did just say lateral tear, like so like it just, being able to like read through
Mhm.
my medical records and like understand them, I'm sure that, is
Yeah.
helpful. And then I listened to, I mean, probably 100 VBAC link podcasts, which I mean, it's just women who have every kind of issue, and
Mhm.
they're all doing it anyway. So it was just, very, very encouraging and made me feel not alone in my fight. And just, yeah.
Do you think that this is going to change? I know you're essentially on mat leave right now, but if you go back to nursing, do you think it's going to change how you practice?
Well, it's so funny because before I had her, I was looking into becoming a midwife, and I had actually shadowed this midwife group that I used. And like when I was shadowing them, they had a mom that was being induced and she was like coping really well and just like on a birth ball. And this was like, I think her second baby. She was like doing her thing. And they were like, an OB came back and he was like, it's been too long. And the midwife was like, no, she's fine. Like, just let her be. And he was like, well, we got 3 more hours or something. Like he like put a time on for no
Mm-hmm.
reason. Like
Mm-hmm.
the baby wasn't in distress. Mom was doing great. Like he was just on his own time. And I was like, that these moms need someone to
Yeah.
stand for them. But then I'm also like, I don't think I could work in that environment either. Like where you feel like you're constantly, you know,
Mm-hmm.
like working for a system that you don't necessarily think is the right one. I
It's
don't know.
hard because we also need people who are
Yes.
like you working inside the system because
Right.
the change comes from within often, right?
I
It's a
know.
tricky one. It's a big
Yeah.
conversation, a big decision. But I mean, obviously, I think you would be incredible at whatever you choose to do and however you choose to support pregnant women, it's going to be incredible. So I'm
Yeah.
excited for you, whatever you choose.
Someday I'm going to go after it when the girls go to school, and
Yeah.
I'll find my way.
Yeah. Ooh, I'm
I'll figure it
excited.
out
Getting
though.
shivers. I'm feeling it. I'm feeling the energy. It's going to be amazing. This is it, right? We can learn so much from books and from practice, but when we've lived something, it's just different. And now you have
Hmm.
lived two very different extremes, which I'm sure
Hmm.
lends a lot, gives you such perspective on so much, right? And that will build so much empathy, but also wisdom in whatever you choose to do as a care provider.
Thank you.